Hello, everybody. My name is Marie-Le Secher, and I'm the founder and CEO of Akesa Health. Every year, 1.5 billion people worldwide experience some form of psychological trauma. However, most of these people do not get the mental health support they need because of the dire shortage of therapists, but also the time, the cost, and the stigma still associated with seeking care. We estimate this to be a $2.7 trillion market globally, about $49 billion just for the US. Now, 10 years ago, life was good. I was finishing my executive MBA, climbing the corporate ladder, traveling the world, when suddenly an accident happened in the family and surfaced some long forgotten childhood trauma. And suddenly, I was one of those 1.5 billion people. It took a very long time to heal, and I went looking for a lot of different therapies. And I was fortunate to eventually find therapies that saved my life. Unfortunately, it wasn't the case for some relatives who committed suicide many years ago because of unhealed trauma. Now, while doing some research about the therapies that helped me and a lot of neuroscience, I realized that the brain, similarly to a bone that can repair itself after a fracture, has an innate self-healing potential. And so, to address the issue of access to care, I launched Akesa Health in the fall of last year to provide mental health digital intervention that enable people to tap into their brain's self-healing potential and get back to mental wellness without the help of a therapist. Our first offering as an app is a guided self-therapy that incorporates a proprietary combination of assessment, so that we can understand better the needs and the preference of users and tailor the therapy to those. Binaural beats, where users listen to a different sound on the left and right ears, and the brain isn't trained on a certain brain wave, and this induces relaxation and improved cognition. And a light movement, which results in an eye movement, which is the key component of EMDR, eye movement desensitization and reprocessing, a therapy that has been widely used and is recommended by the American Psychiatric Association, Department of Defense, and WHO for the treatment of PTSD. Now, we develop a therapy that is about 13 minutes right now, that is tailored to users, that is completely private. There is absolutely no talking or no writing about the trauma. It's trauma agnostics, and we position it as a first step or a supplement to therapy. We've completed our first pilot earlier this year with the Cook County Department of Public Health COVID contact tracer that was suffering from a very high distress after 2 years of COVID, that shows encouraging results with regards to efficacy, ease of use, and demand. And 61% of the users show experience a reduction in distress after using the app only once. We will reach customers first with the B2B to C business model, targeting organizations that employ or serve people suffering from high distress. The beachhead market we are looking at right now is healthcare providers, especially for their nurses. It's 20% of them have resigned during the past 2 years. And on the competitive advantage, so there are therapies out there that are highly efficacious to help people deal with trauma. EMDR is one of them. They are very expensive if you're able to get a therapist, which is almost impossible right now. On the other hand, you have very affordable, sometimes even cheap EMDR apps, so you can download binaural beats and watch them on YouTube as well, but they don't have any scientific validation and they have a very low efficacy. So where we want to position ourselves is a high efficacy offering, but is also very affordable for people. We've grown a very experienced team with very diverse background. Myself, I spent the last 18 years launching businesses for startup and for General Electric over the world on 5 different continents. And we've assembled a team of advisors with both clinical, technology, and business experience who are all passionate about bringing solutions into the market very quickly. And so we envision a world very soon where anybody who has a cell phone will be able to process their own trauma. So here in the US, but I spent time in Sub-Saharan Africa a few years ago as well, and I promise I will go back, not only with money, but with solutions. In order to get there, we are raising $750K to reach the 12 months, the 12 coming months milestone, which is finish development of the app, launching, run efficacy studies, and generate revenue. If you would like to be part of this journey to help everybody get back to mental wellness we all deserve and we all want, please to get in touch. My name is Marie Le Sécher. I can be reached at Marie@Akesa Health. Thank you.